All right, I think we are live. So, good evening, everyone. My name is Kareem Scales. As many of you know, I serve in the role as the Administrator of Operations with the Greater Grand Rapids NAACP. I am serving or coming to you today in the absence of President Clee Jackson, who normally facilitates these community conversations, as we call it. Unfortunately, he had another obligation this evening, so I'll be facilitating today's conversation. We have a pretty dynamic slate of guests. I'm really excited to be a part of this conversation with Dr. Irving Vega, who is with the Michigan State College of Human Medicine. He also serves in a number of other roles in the community. We also have Cira Reyes, who is with the Latino Community Coalition, and also avid community advocate in a number of other areas as well. So as I stated, this is COVID Uncovered Community Conversations Part 5. Again, this is the 5th session. President Jackson has been having these conversations weekly on Thursdays at 6 p.m. And really what it is a platform for us to connect with professionals in the health space and pharmaceutical space to talk about updates related to COVID-19 and the disproportionate impacts on Black and Brown communities. We've had speakers from last week, a couple of speakers from the Kent County Health Department. There's been several of doctors and scientists. So a lot of the information that from our peers that we've heard that has been presented during these conversations is a lot of information that you may not have heard on the news or in other areas. So we pride ourselves on making sure that this is a open forum. So feel free to add your comments or questions, concerns in the comment section at any point throughout the conversation. And also I'm looking forward to some good information from our guests. So with that said, I want to pass it over to Dr. Irving Vega. If you could, sir, first and foremost, thank you for joining us this evening. It's my pleasure to meet you and look forward to learning about your expertise in this space. Tell us a little bit about your background, Dr. Vega.
Hi, thank you for inviting me. I'm a neuroscientist, researcher on Alzheimer's disease and related dementias with the College of Human Medicine. That's my expertise. But lately, once the pandemic hit, I've been working on testing, developing testing for COVID-19. Colleagues of ours in the department developed this test, and my role in the research space also include issues related to health disparities. Like in Alzheimer's disease and related dementias, African American, Blacks, and Latinos are more affected by dementia, specifically Alzheimer's disease, than other ethnic groups. So I've been researching also an aspect of health disparities. And as you know, COVID-19 has hit disproportionately our Black and Latino community here in Michigan and all around the country. And lately, I've been participating in clinical trials for the COVID-19 vaccines. And like I said, doing testing within the community to bring that resource to areas that are underserved within Grand Rapids. So, yep.
No, thanks for that, Dr. Vega. And again, pleasure to have you on this evening. Sergio, a good brother, pleasure to have you on this evening as well. Tell us a little bit, for those who don't know, a little bit about your background and kind of what your role will be in this conversation then.
Thanks for the invitation, Kareem. So yes, I've you invited me today, and I know that we talked about me being with the Irving Core Collective, but really the majority of how I kind of been involved with the COVID-19 and the vaccine has been with the Latino Community Coalition and other conversations with organizing work with Movimiento Cosecha, and then Latinx year in that area. So I'm really happy to be here. I wish we could have other people that have been working more closely with the vaccine, directly with communities of color, especially the Latino community that we're referring to. I'm happy to be here today. Thank you.
Thank you, Sergio, as well. So why don't we go ahead and get started, get into some questions. Looks like we got a few viewers on. So let's get into the first question here. And we'll start with you, Dr. Vega. What, in your opinion, are some of the most, the largest institutional barriers to community members getting the COVID-19 vaccinations? And I want to hear from you specifically as it relates to the Latino community and the community you serve in.
Yeah, unfortunately, we are trying, the healthcare providers continue with the same practices that have perpetuated the healthcare inequalities in our communities. It's the same strategies. For example, they put a place and you have to come to that place and then reaching out to the community that cannot reach that space. It seems to always be an afterthought. First they do one thing and then, now how we can do that. The institutional barriers continue to be the access based on location, based on hours. We know that paying for a place, excessive amount in my view, that is sit in front of the federal court, steps from the ICE office, will definitely put a barrier, an invisible barrier for people in the community that are undocumented. But if we think beyond that, the day worker, with documents or without documents, those day workers that cannot take that day to come downtown to the center of the middle of town to actually get the vaccine, that's an invisible barrier. So the other invisible barrier that I can see is always, we need education. We need to educate our people, the Latino community, before they can accept the vaccine or before we give the vaccine. And that is actually another barrier, because it comes from the mentality that health disparities is kind of a choice. They have the choice to come to take the vaccine, but they don't make that choice. And that's not the problem. The problem is not the lack of education. Actually, the Hispanic Center did a survey. And even though 68% of the people that participated in the survey said that they didn't have information about the vaccine, 74% said that they will or are willing to take the vaccine. So lack of information is kind of an excuse. The excuse that perpetuate the mentality that is that we make a choice to have all these comorbidities or the diseases that affects us disproportionately. And I want that this process becomes more transparent. I want to see the distribution of the vaccines based not only on age and gender, like is in the Michigan vaccine dashboard. I want to see the transparency to include ethnicity, to include rural versus urban, our American Indians and indigenous people. What is that distribution? And in that way, we can actually try to find out why is disproportionately distributed. And what we're going to find is that the places that they choose are not the right one, and they are not making it with the mentality of the needs of the community. I believe that the point of care, in order to resolve the issue of health disparities, has to go closer to the community, not away from the community. And they are still repeating, keeping the point of care away from the community, expecting a different result. I think we need to change that, and I don't know if the energy to change is not there in the traditional healthcare providers, but we have to make them have the energy to do it, and I will do all my best to do that.
No, thanks. You touched on a couple of really good points, Dr. Vega. What I'm hearing from you, one of the major things is like you said, nothing new, but we talk about accessibility. And that's always been an issue as it relates to our communities and having access to these different types of resources. We often hear Brian Stevenson often talk about proximity, and that kind of popped up in my head when you were talking as well. So thanks for answering, Dr. Vega. Sergio, if you feel like you want to comment on that, but also I want to throw your way, kind of just wanted to shift a little bit with, you know, some of our past conversations with President Jackson have been about, you know, just being frank, some of the distrust and the concerns around, you know, is this something that, you know, community feels comfortable with, you know, understanding the distrust that has happened in healthcare with Black and brown communities. Hearing from Dr. Vega that over 70% of people, even without the education, are willing to take this vaccination. I was a little surprised by that number, but I wanted to hear from you, Sergio, kind of what's the word on the street and what you're hearing around, you know, the trust around this vaccine.
Yeah, thanks for that. Yeah, one of the things I'd like to add is a well-known, or maybe, yeah, a well-known barrier, structural barrier is that it's the lack of pre-existing capacity to serve our community, and that's being highlighted right now. That systems, health systems, and institutions, municipalities have historically been lacking in their ability to connect with our community, to communicate. They haven't had established lines of communication. There's been bottlenecks in communication and shortcuts when they check boxes when they say they want to communicate with our community. And so then that's being highlighted right now, where they're relying on institutions that are serving BIPOC communities. But I mean, we're talking about the Latino community, and we're no different in this case. And so that's showing up now. And I think it goes to back what Dr. Vega is saying. And when it comes to trust, I think it's the same thing, where there are systems that have been complicit, especially when you talk about the undocumented community, or like the contract with ICE, or these institutions that have historically, you know, abused their power. The Latino community, it's not a monolith, but I think something that comes, a recurring theme is the fact that we come from countries where authority is important to us, right? It's culture, and so we respect systems, and I think that when it comes to systems in the U.S., they've shown us that that we can't always trust them when they cooperate with ICE, when they treat us differently, when they provide services to us at a different level of service. It's that trust is hard to gain, and if folks are afraid to deal with systems with, like, you know, in this case, as it relates to like public charge, if Latino community has a certain way that they see systems that provide services to them, that's not going to change from from one day to the next. That trust needs to be developed, and that's why they're leaning so heavily on institutions that have the trust of the Latino community.
No, thanks for that, Sergio. Real quick, before we get into the next question, we had a quick question from one of our viewers who's actually an executive committee member of the Grand Rapids NAACP. And maybe Dr. Vega, you can speak to this. How long does it take for the second shot to work in your body? He's wondering, what is that time frame for that second shot to be active? So
the second shot, it usually takes place for the Pfizer after 21 days of the first shot, of the first dose, and the Moderna has to happen 28 days after the first dose. Once you get that second dose, within 12 hours to 14 hours, if you're going to develop some kind of reaction to the immune system, related to the immune system, you're going to start feeling. In my case, I can tell you that was 14 hours that I start feeling the chills and the headache, and that lasted for 6 to 8 hours, and then the fatigue. But after 24 hours to 48 hours, you are completely back in normal. However, I have to point out that if you are one of these people that suffer from allergies, severe allergies, within 10 minutes, you should, if you're going to have a severe reaction, within 10 minutes of the injection, you're going to have that severe reaction. That's why is expected that once you put the second dose, you wait it at the vaccine center for at least 15 minutes. Because in that window between 10 to 15 minutes, if you're going to have a severe reaction, it's going to happen right there. If you're going to have the normal immune system reaction, it's going to take few hours before you get that reaction. I have to say that some people don't feel anything. And that doesn't mean that they didn't put the vaccine. Is that for reasons that we still don't understand, some people don't develop that cytokine, that molecule, that signaling that takes place that leads to the chills and fatigue and headaches. But most people feel that for few hours, and you should start experiences between 12 to 14 hours after the shot.
No, thanks for answering that, Dr. Vega. So just to recap from what I heard him say, the Pfizer second shot will take effect after 21 days and Moderna after 28 days. He also stated if you have...
Let me correct that. The second shot, you should take the second shot 21 days after the first shot.
Got you. Okay.
And the Moderna is 28 days after the first shot. So you take the first shot, you have to wait because each vaccine takes two doses, two shots, right? So after the first shot, if you are in the Pfizer, they have to schedule you within 21 days to get the second shot. And then the Moderna is within 28 days that you have the second shot. Once you get the second shot, then is the time that I was describing, that 10 to 15 minutes is you're going to have a severe, very severe effect. And 12 to 14 hours is the regular time for normal immune reaction.
Got you. No, thanks for clarifying that, Dr. Vega. That's good information. Let me see if we have any other questions. There's one quick question here. I think this is something that came up in one of the previous sessions that we had, and Sergio or Dr. Vega, feel free to speak to this one. Do you, either of you know, how do the rates of this COVID-19, how are they comparing with normal flu cases?
Well,
go ahead.
COVID-19 is currently the third cause of death in the United States. Flu is not even close to that. Okay, in a regular bad season of flu, an average of 30,000 people may die of flu in a bad season of flu. We are approaching 500,000 people that have died of COVID-19 in less than a year. And we're going to reach, potentially, we're going to reach that really bad mark of 500,000 by the year, by March, when we actually was the shutdown, when the shutdown started. That just tells you, with that one, how dangerous and how bad is COVID-19 compared to the flu. And that is without talking about the long-lasting effect that COVID-19 has on the surviving individuals that were infected by this virus. With the flu, you have very bad week, and that's it. With COVID-19, there are people that have suffering long-lasting effects. Brain fog, they call it. Its cognitive function is affected. Pain in the whole body, loss of taste, loss of smell, and symptoms like that have actually endured for more than 6 months. So that also tells you, and that's what people have measured. Well, we know that there are even people that have longer than that. And my research again is in Alzheimer's disease, in neurodegenerative diseases. We know that those people that were in ventilators are going to be a higher risk of developing dementia later on in life.
Yeah, I want to get back into that one, Dr. Vega, because I don't think many people are making those connections as far as dementia and the effects of that. So hopefully that answered your question, Ms. Sky. She said, thanks for the info. So before we get into the next question, I just wanted to share, you shared, Dr. Vega, that COVID is the third cause of death. The flu normally averages around 30,000 deaths per year, and we're already over 300,000. So multiply times 10, and we're not even at a year yet. I don't know if you all saw too. I just saw an article this morning that stated that the U.S. life expectancy just went down a whole year due to COVID-19. So that in itself should tell you, how serious this is. So why don't we go ahead and jump into the next question? Bree had a question around dementia. Bree, we'll get back to the dementia conversation here in a minute. I wanted to pass this one to Sergio, and Dr. Vega, feel free to jump in at any point as well. Sergio, I know that you're always active in the community, your role in the Latino Community Coalition and UCC and the other areas that you work in are directly serving the community. So I wanted to position this one to you. What is the current situation with undocumented immigrants as far as having access to the vaccination at this point in time?
So what we've heard we've been meeting with the Kent County Health Department, and what we hear from them is that the undocumented community qualifies to receive the vaccine. Unfortunately, that's, that the fact that it comes into question is exactly, it's right. I think just because the vaccine is available to them doesn't mean that the undocumented communities know or believe that they can come forth and get the vaccine. I think education needs to be done. We've been doing that ourselves, and that question has come up in talks that Dr. Vega and I have been involved in. But I think something that the public should wonder, at least folks that are not immigrants, that are not undocumented, is how can we expect a specific population that is vulnerable, more vulnerable than the general population? How can we expect that community to be turned away, to be always told that they don't qualify for anything, for any other COVID relief dollars, nothing? They don't qualify for anything, don't qualify for unemployment. All these programs we don't qualify for. I think there's this narrative being pushed that, immigrants, especially undocumented immigrants, come in and rely on government assistance, but they don't qualify. That's just the hard fact. And how can we expect this community to suddenly say that this particular thing they can benefit from? So I think that's one challenge that we're seeing, and that's something that we have to combat, and ensuring that the undocumented community knows that they do qualify for it, and that for providers, for systems, we need to help them understand that trust factor that you asked about earlier is a big factor in ensuring that they come forth and try to take the vaccine. There's also the worry about, and we can talk about that later when it comes to barriers, but there's other questions that they might that come up when they are considering whether to take it or not.
Karim, if I may add what Sergio said, if they wanted to reach out the undocumented or the more vulnerable individuals in the community, it's very easy. They just need to reach out to the community organizations that are already there, and they have the trust of those people in the community. To give you an example, even though the vaccines are different, the Hispanic Center organized a flu vaccination activity. In one afternoon, in just few hours, they vaccinated more than 200 people. They did it with Myers, and Myers had to run back to the pharmacy to get more vaccines because they didn't bring enough, expecting that people would not show up. And actually, they had to go back to the pharmacy to get even more vaccines for the flu. It's very easy. They know that there is places like Exalta Health that serve the uninsured and underinsured in the community. Why they are not a vaccination center? They already serve in this community. They already have their trust. Why they are not giving them the authorization to put vaccines in arms? It's just the things are very simple. It's just to do a community-based approach with the intention to actually resolve the problem. They can do it if they want. They have the power to do it. They just have to call people like Sergio and other leaders in the community that know where those places are, and they will come. The people in the community will have the trust to go get the vaccine. The access will be there, and people will get vaccinated. So they can do it. They just have to think about it and go around and put excuses. It's time for action.
Thank you, Dr. Vega. Appreciate those comments. Couple of things I wanted to add. We have a couple more comments. Our own secretary, shout out to Ms. Gail Harvey Holmes. She put a comment in that when we talk about the life expectancy level going down, she said actually for Blacks it went down 3 years, and for the Latino community it went down 1.9 years. So once again, we see the data reflecting where our communities are hit astronomically at a harder level. And this is just, like you said, not even 1 year in, so we don't know what the long-term implications are. But why don't we, with that said, go ahead and jump into another question. Next question more so relates to employers in conducting routine safety inspections. How can we help employers and conduct routine safety inspections to protect employees from abusive practices?
Sergio, you want to go first?
So I think when it comes to that, I think that it's two steps. One is providing, especially when it comes to BIPOC communities, and this is the demographic that we're talking about. I think that we need to look at the employers that are hiring them and ensure that these employers have the help that they need, the resources that they need, but then also pair that with accountability. We need to start tracking numbers. We need to ensure that they're tracking who they're serving and how they do business. I think with when it comes to like businesses like speaking like for the Hispanic Chamber of West Michigan, those businesses that are Latino owned, that might need more information, that are have some questions about it, we need to ensure that organizations like that government entities rely on organizations that have the trust of the community, that have the reach to these specific businesses, and that that message is getting through, that the education is happening and the resources are happening, like to do the testing, but also followed with accountability. So I think that's it's not really my strong, so there's not something that I'm involved personally, but I think that from what I hear from people like Guillermo Cisneros with the Hispanic Chamber, I think those are some of the services that they're providing, and that's something that he talks about constantly.
No, thanks for that, Sergio. Did you have anything you wanted to add, Dr. Vega? Or no?
I will actually just echo what Sergio said: accountability, education, and then follow with accountability. That's the only way to secure a safe environment for the employees.
Gotcha. No, thanks again, Dr. Vega. I want to jump back to something you alluded to earlier, and this one is really interesting because I don't think a lot of people are aware of the connection between people living with dementia and the support for caregivers. So I wanted to see if we can kind of dive into that, Dr. Vega. Talk to us a little bit about what you've seen out there as it relates to the support for caregivers of people living with dementia during the pandemic.
Yeah, it's another thing that illustrates the disconnect between the health department and the needs in the community, right? Effort has been placed into assisted living facilities to vaccinate the people in these assisted living facilities and institutions that have been hit really hard. No mistake about it. They have been hit really hard with COVID-19 because there are people that depends on the care provided by others that go outside of those facilities, and they bring the virus, and they have comorbidities that put them in, and also the age put them at higher risk of developing severe symptoms and even die. But in our communities, and talking about specifically the Latino community, most of the people that have a loved one that live with dementia or neurodegenerative diseases, they cannot afford putting their loved one in an assisted living facility. So they usually are cared by their family members. And those sometimes turn out to be 24/7 caregivers. And now you have these individuals at home that fit the description of people that are in assisted facilities, but they don't have access to the vaccine. They actually were overlooked in the planning on how to bring those vaccines to people that are bedbound, or they're actually at the houses living with dementia and not able to have access because they cannot bring that patient to a vaccination center in downtown, for example. And then they're not putting it in the list for the people that are within the system already. So it has been an overlook, and now I think they're trying to go around that, and unfortunately they go back to the same, that there is not enough vaccines, that there is not enough resources, that I think when you want to do it, you can find a way to do it, and it's easy to involve a different organization like the National Guard and transport these vaccines and make more community center areas that these people can come and then get the vaccine. So it's a problem. It's something that is being discussed in different. I'm involved with the Michigan Dementia Coalition too, and we're talking about it. Try to bring awareness to the policymakers to make sure that people living with dementia that are not in institution, that are at home, and their care partners are being taken care with the same urgency like the people that are institutionalized.
Yeah, that's actually pretty interesting how when you think about that, because essentially they're frontline workers inadvertently, been trying to serve for their loved ones, but not having equal access to the vaccine. So thanks for that, Dr. Vega. Want to see if we have any other comments before we jump into the next question. And again, for all of our viewers, anyone who is listening or watching, feel free to add any of your comments in the comment section, and we'll make sure to ask those to our panelists. Want to get into another conversation that relates more so to financial support and government assistance in this pandemic. I want to shift this one kind of to Sergio, just again, with your experience being in the community. What are some ways that you think that we can ensure equal access to financial support and government assistance as it relates to the COVID-19 vaccination? And this is a two-parted question, so I'll let you speak to that one, and then we'll ask the second part. But specifically, equal access and financial support from government in this time.
Yeah, I think when it comes to that, I think going back to the relationships and the trust and pre-existing working relationships, especially if the county that received $14 million from the federal government, if they didn't have existing relationships, trust, and working relationships on a regular basis, if the people that they contract with do not know who to go to, I think that's a big factor. I think that's one way to ensure that there's equal access to the funds that come to the communities that need them most, is that those relationships exist from the beginning. But if that's not the case, I think that this should be taken as an opportunity for those relationships to be developed permanently. It shouldn't be a one-time thing. It should be using those dollars, using this learning experience, this learning opportunity, whether it's a city, whether it's a county, whether it's a health system, that has to rely on organizations that have the trust of community, that understand community, that have the capacity to serve community, having the understanding the opportunity that they have in their hand, that this is a lesson that they're learning, that if they choose to once again simply rely on the free service, the free work, the free borrowed networks, and the free trust of community stakeholders that are doing this because they know that their community is hurting, that their businesses are hurting, that their organizations are hurting, the people that the organizations serve are hurting. If they rely on just another free borrowed networks, then what this is going to cost is, people are going to get tired of this. There's going to be organizations that are no longer going to be willing to work with the system because this is an extractive method. The other way that we can, I think, ensure that there's equal access is we need to demand that these systems track who they serve, track race, ethnicity, track where the money is heading, and so that we as organizations also should hold these systems accountable so that the dollars make it to our communities proportionately, not just when the services are received in terms of the numbers of vaccines and who get served, but also that the organizations that are providing those services, that are bringing the vaccines to community, are also being sourced, and there are also new relationships are being developed. Like, for example, for businesses, that organizations like the Chamber of Commerce that are partnering with the county to ensure that that these dollars are transferred to community proportionately.
Thanks, Sergio. Dr. Vega, did you want to speak to that one at all? Just more so talking about financial support and equal access from government as it relates to resources for the COVID-19.
I think Sergio said it correctly. I mean, the main issue is transparency. The lack of transparency doesn't allow us to measure and to hold accountable the leaders in the community that these resources are distributed proportionally unfairly to all communities. And that lack of transparency affects the trust and affects everything, right? So I think that's what we need now with that aspect of financial accountability, but also with the vaccines. We need more transparent process so that people can start trusting the system.
No, thanks, guys. I want to go a little bit off course without shifting too far, but I think I'd be remiss if I didn't bring this up. So just recently this week, a national organization, the NAACP, has filed a lawsuit against our previous president for what happened on January 6th. So just kind of wanted to see if you all had any comments you wanted to share about, kind of what your thoughts are as it relates to that.
I think is the right move. The NAACP have a big history on that line to support the rights of everyone. And I think it's the right move, and we'll see what happens at court. But it is needed to have accountability. You cannot ask responsibility of anyone if there is not an accountability process. So I think is the right move, and we'll see what happens in court.
The same. I think that we can't, given the math, it doesn't add up. You know, he wasn't able to be impeached. But I think that we need to pursue all proper channels and other channels beyond that. And I think a civil lawsuit, I think, sends a powerful message. I think this is a movement. We're in the middle of a movement where people want to ensure that this doesn't happen again. And this is only gonna happen if the institutions that we trust come forth and take brave and bold steps to ensure that it doesn't happen again. And what it does, it just doesn't do that. It also, people are watching, people are counting on this. And I think that if the institutions that we trust don't take these bold steps, then who are we going to count on? There's organizers and there's other ways to do it. But I think that at this time, it's all hands on deck. I think there's a place for everybody, as I like to say in organizing language. There's a place for everyone in the movement, and I think that that's another stone that shouldn't be left unturned.
I agree. I think you guys both said it well. I'll just, speak from my own personal perspective. Obviously, being a member and also working with this organization, it just, it makes you feel a sense of pride to know that the NAACP is taking a bold stance. And this is nothing new for this organization, being in existence over 100 years. They've, continuously, pushed back on these agendas for some time. So I'm extremely proud to see that initiative. Like Irving said, we'll have to see what happens in court. That's a whole nother scenario. Want to get into one more question. I don't think we have any more questions in the comments right now, but one more question, and then we can just kind of keep it open for anything else you fellas would like to share. But this is kind of the last question for you both. And also we'll maybe start with you, Dr. Vega. What are some of your thoughts on how local leadership can better serve our community in this crisis, or better serve your community in this crisis?
Reaching out, stop the traditional way of doing things, because you're gonna continue having the same results. Everyone knows that Blacks and Latinos were disproportionately affected with COVID-19. Why then? Why? More of the vaccines have gone to whites than Blacks and Latinos in Grand Rapids. Mercy Health publicly said that from the vaccines that they got, that they received, only 3% went to Black and 3% went to Latinos. So that means that there is a disproportional, it's not a problem of how many vaccines they come. We know that there is a logistical problem in terms of the vaccines that are coming into the pipeline. But once you receive the vaccine, it's your responsibility as leaders that represent everyone in the community to distribute them proportionally, to reach out to those that are more affected and more vulnerable in the community, and from there walk to the ones that are less vulnerable. And we're not seeing that. So from the leaders, from those that are decision makers, as they call it, you are accountable. Now you have an instrument that it was made available to you to take us away from this pandemic, to help us get out of this pandemic. So as member of the community, what I expect is that you take that leadership, that power that was given to you, and put it to serve the community. Not few people, to serve everyone in the community in a fair and equitable way, equal to everyone. It's not putting excuses that we have very few vaccines, there's not the resources, that these vaccines need to be a -80 or -20 and they need complicated instruments. No, don't tell me that, because you converted a convention center in a vaccination center. If you were able to do that, you have the power to do things. So it's time to serve everyone. It's time to put words in actions. I see many of these leaders talking about diversity, equity, and inclusion, and they have committees and they have community talks, and it all stay in words. I want to see action. I want to see change. I want to see that in a transparent way, in a real-time dashboard. When you tell me you get 10 vaccines, how those 10 vaccines were distributed in our community. Did everyone, it's your responsibility as a leader that everyone has the same access to those vaccines that you receive. And that's what I expect from the leaders of this community.
Thanks for that, Dr. Vega. Sergio.
I think as Dr. Vega was talking about, something that comes to mind here in West Michigan, I probably said this in another talk that you might have invited me to, is that a lot of tradition here in West Michigan is so strong that we sometimes forget that we have options. And one of the things that I hear a lot is people staying in their lane. Like, what does my organization do? What is my organization about? And our boards and people tell us to stay in our lanes. But I think right now we're living in extraordinary circumstances, and there's extraordinary events happening. So I think that, like Dr. Vega said, that people who are in a position of leadership, who have access to budgets, who have access to platforms, whether it's like media outlets, whether it's the authority figures, whether they're sitting in positions of authority that we maybe elected them to, that they're hired to, whether they're public servants. I think that even people that are outside of the medical field, we all have a responsibility to leverage those relationships, those platforms, and those resources to ensure that that we're serving community to our full capacity. And this applies especially to BIPOC communities, communities that are in the front lines of this, that are disproportionately being impacted by the effects of COVID-19, people that do not have access to the vaccine because of historical systemic racism and the impacts of that. I think that it's all of our responsibility to push beyond that. I think now is a time to break the norms. And now is a time to not settle for the same excuses from institutions that serve us. And I think it's also in our duty to think creatively, to think outside the box, and to think innovatively on how we can make things possible. I think when I was just having a conversation with a friend that about people, I think it was in New York, these young entrepreneurs that got access to distribute vaccines, and they mismanaged it. But I think applying that approach where this might not be true, but I think there's always ways for other people to conduct or to supplement how the federal government, local government, municipalities at different levels can provide services to the community. And in this case, it's all hands on deck, and we need to think creatively about how we can help our county, our health department, to build that capacity by leveraging the networks that we have, by leveraging the institutions that maybe we lead as leaders. And I think that's how I see it. The last thing I want to say about that is that we, as leaders, we need to think about holding these institutions accountable. I have said it at the beginning of this conversation that there was a lack of capacity to serve our communities the way that we deserve to be served, and that we shouldn't let this opportunity where we have their attention, where this lack of trust, this lack of capacity to serve us has come to the forefront, is there for display. We can't allow these institutions to go back to the way they operate, once the pandemic subsides, or once that there's that fatigue about this being a new thing. And so that I think that's another opportunity that folks in leadership have to right now to leverage those relationships and the tables that they sit at to hold institutions accountable to change permanently, to use this learning lesson to make permanent changes and not just to deal with the crisis at hand, but from this point going forward, how are they going to be different? You know, a good example is Texas. You know, the government in Texas and elected officials decided to go on a different route and to go with gas and not build capacity to serve their people. And they knew about this, you know, decades before that. They chose not to do that. We're at that space now where we can hold our elected officials accountable in systems that serve us so that they can make permanent changes so that if anything like this ever happens again, our communities won't be disproportionately impacted.
No, thank you both, guys. I think you both hit on some really key points. One thing that really stood out from what I was hearing you say, Sergio, is that it's important, regardless of what your title is or what your specialty is at this time, it's important that all of us who are in a position to serve as what I like to call a resource broker to our community. I mean, I think too often people say, well, that's not my lane, that's not my specialty. But in this time, I think it's important that we all come to the table and do what we can to help our community see the other side of this. I think we got one other question that just came through the comments, and then I had another quick question from Newitt Sky. Her question is, if doctors or other healthcare professionals choose not to get the COVID vaccine, are they still able to see patients? That's a good question. Do you know that one, Dr. Vega? Or are doctors required, or if they're not required, how does their access to patients, how does that work?
That's a great question. I don't know a specific situation where has been required for physician to be vaccinated. I at least on my experience, and I don't have much information like that. All the people that are in the health system are there trying to get vaccinated as quick as possible. I think it's a responsibility of the medical, as a doctor, as physicians, to get the vaccine. But in the cases of individuals that are decide not to be vaccinated, which I don't know if that is happening or that is a problem. My impression, based on information or just association with a medical school, is that everyone is getting vaccinated. But in the case, the question is whether they should see patients. That depends on the institutions, right? The healthcare system is very it's an industry, and they have the rules for their employees. Whether they can enforce that and suspend the privilege to the individuals, that will be something that they can force. The problem is the ones that have private clinics, and they are on their own outside of the system, who enforce that. So it's a very good question. It's something for the lawyers and the NAACP to dig on that aspect. But I cannot give more information than that.
No, thanks, Dr. Vega. Sergio, you have anything you wanted to share about that one? Specific to the question was, if doctors or other healthcare professionals choose not to get COVID vaccines, even if you don't know the answer, I guess, just what is your thought around that, Sergio?
As far as I know, that people aren't required to, folks in the medical profession, and it's not that they're not forced to. And this I'm sharing from, we have regularly occurring meetings every 2 weeks with the health department, and we heard from them directly that medical professionals aren't required to take these vaccines, and yes, they are allowed to continue to treat people.
All right, thank you. All right, so we're approaching 6:55. I want to get into closing comments, but I wanted to share one other thing that came to mind as Sergio was talking about, others having to adapt and wear different hats to serve community in this time. And it made me think of a quote from the late, great Fred Hampton. And for those of you who aren't aware and haven't seen the film that was recently released, Judas and the Black Messiah, I strongly encourage everyone to watch that film. It's extremely empowering. But the quote is, if you walk through life and don't help anybody, then you haven't had much of a life. And I know that sounds like a really simple quote, but I think it speaks to this conversation and hopefully empowers others to do what they can to serve community in this time. Fellas, before we go, I want to get into closing comments. One other quick question, and this is just me, just concerned about what you guys are thinking. Post-pandemic, I might be jumping ahead, but I'm already ready for post-pandemic. So post-pandemic, what is the biggest challenge that we see that you guys think is going to be something that needs to be addressed post-pandemic? Is it going to be education? Is it going to be housing, employment? I think all those will be a concern, but which one do you think is going to be the key area of concern?
If I go first, I think there's so many that are going to need to be addressed. Of course, the root of a powerful and productive community is good health, and how much long-lasting effects on COVID-19 will have in our community, in the millions that have been infected, is still something to see, because even though we are in this challenge that's supposed to be an opportunity to rethink and to change, there is resistance to change. And what we'll see is that long-lasting effects may overburn the health system as it is if it doesn't change. So I think health will be a priority to go back, and it will take years for that. We're talking about 2024. People have been suggested in terms of the long-lasting effects of COVID-19. In terms of the other factor that actually indirectly impact also economy is education. So health, education, and then economy are going to be the aspects that we need to work. But if we don't pay attention in putting our kids and from all levels back to where they're supposed to be, and provide and take this opportunity to strengthen the education system and the health system, the economy is always going to be vulnerable to things like this. Rest assured that a new pandemic is not away from us. This is going to happen again. And it took over 100 years to happen, but with all the things that we are seeing with climate change and globalization, another pandemic will not take 100 years like this one. So if we don't work with the health system and reform it, if we don't reform the education, economy is always going to be vulnerable.
Thank you, Dr. Vega. And Sergio, if you want to speak to that last question around biggest challenge post-pandemic.
Yeah, that was I'll admit that was a tough one, and Dr. Vega talking gave me some time to think. But there's multiple areas that we can focus on, but I think that because there's these disparities that were in existence, I think that those people that had some privilege, those people that had some resource, that have means, that have access, like to the Wi-Fi, to work from home, all those individuals were in a position of privilege, of advantage, and I think that what I'm afraid of is that this pandemic, when you factor in that we're in a capitalistic society, I think it's going to put the people with an advantage, at even more advantage, and we're going to have to play catch up with communities of color that were already not prepared to deal with this, and that were going to be impacted negatively by the pandemic. I think we're going to have to be playing catch up, I think, to sum it up. And like Dr. Vega said, we need to look at how we're going to prevent this from happening again. And to me, it just seems like the same old, same old. we weren't prepared. It just disproportionately affected us, and we're going to be playing catch up for communities of color, in the time, in the next decade.
Well, thank you both, guys. Before we wrap up, again, let's want to go closing comments, Dr. Vega, then Sergio, and then we'll go ahead and conclude today's session.
Well, thank you very much to you, Karim, and the NAACP for this opportunity to talk to you guys and your community in this very powerful organization that have hundreds of years of serving and safeguarding the rights of the most vulnerable. I have to say that you have to guys have to still be aware and be vigilant of the disproportional distribution of this new tool that we have available to fight this pandemic, and it's the vaccine. I see that there is a lot of excuses, but this is the right of everyone to have good health. And if some people unintentionally or intentionally are denying that right, that it goes to the most fundamental principles of or rights of a human being, that is being healthy and being alive. And I think that it's time for people to move to action and to not try to continue doing the same thing and expecting a different result. We from the community are ready. We are extending our hands to work with you, with those leaders, to bring those vaccines closer, to bring that point of care closer to the most vulnerable. Are you guys willing, at those in position of power and leadership, are willing to take that hand and work with us and within our communities? I think that's what we need to ask. We need to ask for transparency, and we need to ask for the right of health. And now it's not time to hold that tool for someone and give it to other ones. And what I want to bring to your attention, and I know we are short of time, but I want to bring to your attention that the two vaccines that are currently approved are the most efficient vaccines against COVID-19. But behind these two are coming another vaccines that are not as efficient, but they're cheaper. They're much cheaper. We're talking that every dose of Moderna is about $50, and a dose of the Johnson & Johnson vaccine that is not as effective as Moderna and Pfizer is definitely more cheaper, about $10 or less. And the AstraZeneca is even cheaper. So what I don't want is in the future, and I would like institutions like the NAACP to be aware that in the near future, when that Johnson & Johnson get approved, which have shown to have side effects, more side effects and severe side effects compared to Moderna and Pfizer, that the Johnson & Johnson become all of a sudden available to the community of colors, to the Black and the Latino community, and not the Moderna and the Pfizer. Because the excuse is that vaccine can be managed and can be transported like the flu vaccine. So because it's easy to transport, let's just put that one out there. I think that there is intentionally or unintentionally the creation of a bottleneck to that to happen. And I see it, I can see it coming. And I just want to make everyone aware that when the Johnson & Johnson, that is the one already in evaluation at the FDA, gets approved, I want to see if that's the one that ends up in our community and not the Moderna and the Pfizer. I'm calling that shot right now, and I'm going to be vigilant for those people that are responsible to distribute the vaccines.
No, thank you for that, Dr. Vega. That's a big one there. We'll have to keep a close eye on that, and we'll make sure to give you credit. But we don't want that Johnson & Johnson. I want that Moderna or the Pfizer. Sergio, please, brother, closing comments.
Well, just want to thank you and the NAACP for inviting us over to share with your networks and the, your viewers some of the struggles and bringing to light what is happening with the Latino community, with the Latinx community. And I know that there's a lot of similarities with other communities of color. And so want to thank you for that. I think that there's a big opportunity for us to work together to fight systems when communities of color are disproportionately represented in the positive test results, and yet when the vaccine comes available and that white folks are the ones that are disproportionately getting the vaccine, that really speaks to the structural and systemic racism and beyond that, white supremacy. And so I think that the conversations like this give me a lot of hope for what we can accomplish together when different communities come together. And I want to thank, I know you invited me here, but I think the folks that are doing a lot of work, like friends at the Hispanic Center, at least with the Latino community, Movimiento Cosecha, the Hispanic Chamber that's helping businesses, and those are the folks that are in the front lines, and I want to give them credit where it's due, and want to thank them for all the work that they're doing, and hopefully this conversation continues. Thank you.
Again, thank you both. Huge thanks to Dr. Vega. It was a pleasure to meet you. Again, looking forward to meet you in person post-pandemic. Sorry, we had a couple other comments that we weren't able to get to, but please, everyone, join the future sessions. We'll be doing this every Thursday at 6 p.m. We have some pretty exciting guests for next week. And the whole reason that we do this is for community to have a voice and have access to the resources as it relates to this pandemic. Again, thanks, Dr. Vega. Huge thank you to Sergio for always, being willing to support and being a part of this work. Again, the mission of NAACP is the National Association Advancement of all people, specifically colored people, but to end racial discrimination for all people. So it's important that we have you brothers on to speak from your perspective about what's going on in your community. Thanks for the info from New Sky. Thank you, Ms. Sky, for joining and bringing some really good questions to the conversation. Thanks to Randy Strobel, Benton, Jerome, Robin, Felipe, Pena, Gail Harvey, Juan Daniel Castro, and all of our guests this evening, Bree J, Austin Roberts. With that said, I want to wrap it up. Before we go, I want to just say here's thanks to our team over at NAACP. One last, no pun intended, I want to give a huge shout out to our producer behind the scenes. See if you can see this as well. Onesimus Peewee, the owner of Finesse Culture. He's responsible for the hoodie today. So those of you who are interested in purchasing, this is a Black History Month exclusive. You can visit his website at thefcapparel.com. And for 24 hours, this hoodie is exclusive, or it's actually discounted down to $35. So it's normally $50. So huge shout out to Onesimus Peewee and the Finesse Culture for providing me with the hoodie today. And please support if you can. Everyone else, thank you again, Dr. Vega. Thank you, Sergio. And look forward to seeing everyone next week.
Thank you, Kareem.
Thank you. Bye.
Bye.